So, look, the first thing is to take a look at the symptoms of depression. A psychiatric disorder that comprises a whole bunch of symptoms which can affect your body, can affect your brain. So I would advise to Google major depressive disorder. That's what it's called these days, and that'll help you identify, whether you might be meeting these criteria. Okay, so look, depression is a very tough thing, and it makes diabetes that much harder to manage. And they exacerbate one another. The diabetes makes depression more likely, the depression makes diabetes harder to manage, and it just ends up being a cycle of overwhelm. We now know from, MRI brain scan research is that when you have diabetes, your blood sugars are going to fluctuate. When your blood sugars fluctuate, the amount of glucose that your brain receives alters. It's different from what a person who has normal blood sugar all the time will receive. And our brains are really wonderful things, but they're not very good at coping with alterations in blood glucose. Glucose is the single most important thing for the functioning of the brain. If you're going low, your brain is deprived. If you're going high, there's too much glucose and a whole neurological process happens. And what that means is diabetes, we're at risk of it, not just because this condition is hard to live with, but because our brains are vulnerable to developing it. Depression is, after anxiety, one of the most treatable conditions. Certainly that's the case in people who have diabetes. One form of treatment is therapy, and it doesn't need to be with a diabetes-focused therapist like myself. It can be with any therapist. The other route is medication, and you'd need to consult with a psychiatrist for that, but antidepressant medications are often prescribed to people with diabetes.